right. Hello, I'm Dr. Gary Davis from Spectrum Health Services. I want you to give some thought to your health, what you're at risk for, but also your health overall. A couple questions that I wanted to answer that people ask often, and one is, why is being up to date on preventive services and screenings an important component to primary health care? The whole idea with screening is that you get testing done before you have symptoms. So often people are told to listen to your body. If you have an ache or pain, you should see your physician. But in the case of prevention, you really want to be seen before you have symptoms. And so the important screenings for adults are colon cancer screening, mammogram, Pap or cervical cancer screening for women. And so again, those often don't have symptoms. So getting those tests done while you're well is really important. Another question is, what can African Americans in Philadelphia do to increase their life expectancy? One is to get the proper health screenings, which we were just talking about. The other is to know your risk. The number one cause of death among all Americans, and particularly among men, is heart disease. So knowing your risk of heart disease is really important. And how do you know your risk? One is to know your cholesterol, get your blood sugar checked, get your blood pressure checked. If you are a smoker, you should talk with your doctor, provider about strategies for quitting. And you should know your family history. All of these things together kind of give you an overall risk for heart disease. Again, you may not have symptoms of these things, but you want to control these things to prevent heart disease. This will definitely increase, I think, everyone's life expectancy, no matter where you start. And in what ways is my approach to adult health, will it fortify the overall quality of life for patients? I think in primary care, the whole idea is to get to know your doctor before you're sick. We want to see you when you're sick, of course, but a lot of the things that really prolong life and make people, I think, well in the long term are these preventative strategies. So you should think of us as being your sort of preventive medicine, health maintenance provider. Most people know they may have a specialist for their heart or for their skin or for their digestive system. The primary care really focuses on prevention. So when you come here, don't just come when you're sick, but when you're well. Be up to date on your well visits so we can do the proper screenings, know your risk, we can talk about prevention. You should know that at Spectrum we have a whole team of folks, providers who are doctors, nurses, dietitians, behavioral health consultants, and so we're really here to look at the whole person, really give you an idea about how you can improve your health overall. So we're standing by for you to come in so we can help. Thank you.